this changed or became more codified after World War II for obvious reasons of what happened with the um, medico-fascism, etc. But that wasn't just Germany. It was the same thing was happening in the United States with the technocracy movement and with forced vaccination and sterilization, etc. Rather, forced sterilization of people who were considered less fit to be reproductive humans by people who decided that they could take that role. So it's all based on informed consent, which means that you can, or bodily autonomy. So you cannot force something on anyone. And you have to give them all the information, both sides of the equation, so that they can make an informed choice. And this is the very basis of medical ethics. So that, I mean, clearly that didn't happen in COVID. And that what COVID showed us is how easy it is to completely upend what we thought was medical ethics. I mean, we should have known because Germany was leading medical ethics in the 1920s, and then the German health profession was they had more representatives in the SS than any other profession. So they were very keen on, by and large, on fascism after they excluded their, I think, 40% Jewish ethnicities. So yeah, it's very easy, and there's a long history of public health going down this road. So the idea of post-World War II ethics was really to stop doctors from abusing patients and abusing the population, and that's what the Nuremberg Code was about. It's what the Helsinki declarations and so on around research ethics and the declarations on informed consent is what the Universal Declaration of Human Rights is about. So rather than follow that path in COVID, we decided we will go back to the 1920s, 30s technocracy idea that there are experts and they will tell everyone else what to do. And because they're experts, everyone else must follow. So it's exactly what happened with the eugenics movement, is exactly what happened in the technocracy movement, which is, 500,000 people in North America.
It's very
And
uncomfortable to talk about this too.
well, it is, but we have to, and we shouldn't be that surprised. What happened in Europe in the 1930s and 40s was done by the people who lived in Europe in the 1910s and 20s. It wasn't different people. They're people like us. And this was not just Europe, this was North America. I mean, if you look at I'm Australian, the history of how Australians, the European Australians treated the native population. You can see that people who appear normal and decent and civilized can do really horrible things really quickly. And that's why we have these inviolable rules of ethics. And we decided in COVID that because we convinced ourselves, or someone convinced us, decided to convince us, people, that it was such a threat, such an emergency, even though the average age of death was over 80, that we had to throw away all these ethics and go back to experts telling everyone else what to do. And, the whole point of ethics is that you can never do that. The whole point of ethics is that there are inviolable rules on the way humans interact with each other. But it is that easy for us to decide to go against this. So this is why we need these firewalls between government and between industry. It's why we need firewalls between WHO and the private sector. We always think we can handle this, but history tells us that we never can.